was just like any other day. It was July. It was in the summer. It was outside. It's a beautiful day. Needed to get some stuff done. Decided, great day to wash my truck. Just woke up. Never knew that the day would turn out the way that it did. And all of a sudden, just got this really bad headache. And it's unusual. Like, I've had headaches before, but it's unbelievable. My vision was kind of coming and going at times. Things were getting blurry. Felt really confused and kind of just unsteady. I was just like, oh man, like, this doesn't feel right. And even saying that out loud is hard to get those words out. And I had no idea what was going on. Started seeing lights, and then next thing I know, I was on the ground.
The first time that I met Ben, he was brought into the emergency room by 3 of his roommates. Ben was brought into the emergency room because he collapsed and had a seizure. Upon evaluation, I found that he was having severe headaches and blurred vision almost all day before he collapsed into the seizure. And after doing a few more tests, I ordered an MRI and a CT scan of the brain just to see what was going on, take a closer look at the brain. Once we received the results of the MRI and CT scan, I saw some just abnormalities with the blood vessels within the brain and just wanted to take a little closer look at that, so I ordered another test called a cerebral arteriography. And I had my suspicions about what might have been wrong with Ben, but I wanted to be 100% sure before I told him anything, so we waited for the results of the cerebral arteriography. And when these results came in, we found that Ben did have an abnormality with the blood vessels within his brain, and this is also known as arterial venous malformation, or AVM for short.
After Dr. Heekins explained what it might be, we ran some tests. We did the MRI, we did a CT scan, and we did this thing called a cerebral angiogram. And they were looking at the veins and arteries in my brain. And after the test results came back, Dr. Heekins told me that I had a arterial venous malformation. And I've never heard of this before. I'm scared. I'm 29 years old. I've never had any medical conditions, and I'm laying in this hospital bed, and the only thing I could ask him is, am I going to die?
Arterial venous malformation can be described as an abnormal formation or connections of blood vessels within the body. These blood vessels can include arteries, veins, and capillaries. It's basically like the blood vessels become tangled in a certain part of the body, and because of this, it comprises the ability of the body to circulate blood adequately. These happen in 1% of the population and are very rare, and when we see AVMs in the brain or spinal cord, it becomes a much more serious issue than if they were in some other part of the body. So when we look at signs and symptoms, they can differ from person to person depending on the location of the AVM within the body. If you were to have a brain AVM, some signs and symptoms that you can have, like Ben, you can have a severe headache, seizures, memory lapses, some confusion, blurred vision, and possibly some intracranial bleeding, which is a much more serious issue because it's bleeding within the brain, and the blood has nowhere to go, so it becomes a very serious issue. When we see this AVM in the spinal cord, they can experience things like the inability to move a limb, muscle weakness, and a lack of coordination. The causes of AVM is still unknown at this point. It is believed to be a congenital disease, however, so meaning that you were born with the disease. But however, it is not believed to be hereditary, meaning that it is not passed down from the birth mother or father.
Dr. Heekins explained to me, he said, we're going to need to resect the AVM, and so I'm going to have open brain surgery. They're going to have to surgically remove it. So that's my best option right now in order to survive. I didn't know what to think. I mean, I knew that he knew the right diagnosis and the right plan of action, so I was confident that this was my best bet. I needed to get brain surgery. I didn't see this coming.
Ben's surgery was completed and was very successful, and we had very minimal complications, and he was recovering very well and fast. Overall, the surgery was very successful. There are other treatment options for AVM, but these treatment options have to depend on where the AVM is in the body, the age of the person, and the physical health of that patient. The most important goal of any treatment for AVM is to make sure we stop or prevent any internal bleeding from happening. Because if you're like Ben and you have an AVM within the brain, this can cause things like a stroke, a seizure, or even death sometimes. Treatment can include prescribed medications from your doctor, and this is more of a management other than a complete fix if the AVM is not that severe. Or you could be like Ben and get a surgery for the AVM and get it removed or repaired.
Woke up after surgery. I was laying in the hospital bed. Dr. Heekins was standing over me with the biggest grin on his face, and he said, "Ben, we got it." It's the best thing I've ever heard. Now that I know what arteriovenous malformations are, it's important to know the signs and symptoms. One day you might have a bad headache, maybe some numbness, tingling, unsteady, difficulty speaking. There might be something else going on. It might not just be a headache. Make sure you have regular follow-ups with your physicians and let them know everything that's going on. Because if they can catch it soon enough, you can live a nice, healthy life. And thanks to Dr. Heekins, I can too.